Dibble, welcome. You're visiting from Yokohama, Japan.
Nice to be here.
You grew up here in Louisville, but how long have you lived in Japan?
Lived in Japan for 21 years.
What do you do there?
I teach, translate, and I do some PR stuff, work at a cram school, a lot of stuff with the language.
Family?
I'm married to a Japanese gal. She grew up near Yokohama. And we have 4 kids, 12, 10, 8, and 6.
Since we're here to talk about healthcare reform in the U.S., let's just start in with the prenatal care, the maternity, the labor. What's the MO over there?
It's great. The mother will stay in the hospital for 1 week.
Okay, so they'll kick them out after 24 or 48 hours like they do in the U.S.
The mother's in the hospital for a week. If everything's okay, we go home. We paid $4,000, about $4,000, and the city or the insurance program picks it up. So it's 70%, and you go. It's worked out through the city.
Okay, so it's a national system, but...
The national system, but you pay through the city.
Okay. And from there, just tell us, generally, how does it work? Can you give me just kind of a summary of the system? Do you pay premiums or you don't pay premiums?
It's a hybrid system, okay? You have company employer insurance, or you have a national health care insurance. It's called Kokumin Hoken in Japanese. The state pays 70% of your health care bills. So you pay 30%. You do get a national insurance card. You can use that anywhere in the country. For folks over 70, it's 20% to use that national health care insurance.
Now, it's a national health care. Is it like Canada? Is it like the UK, where we hear these horror stories about rationing and people waiting years for hip surgery? Is it like that?
Not at all. Everybody I talk to, I've never heard that story from somebody not being refused treatment. Mm-hmm. For example, my father-in-law, he had 3 procedures last year. He had a double bypass, an aneurysm thing, and then an eye surgery. And the care was terrific.
But start to finish, he didn't have to, wait in line or anything.
No, not at all. The doctors were terrific. They discussed everything with my in-laws, explained the risks, explained any kind of contingencies. Just terrific.
So they were happy with their care?
Extremely, when I talked to her about this.
The main question I had is, what do you pay for this? Do you pay nothing?
Oh, we pay premiums.
Okay.
For this. I think it's about, we have 4 kids. It's about $200. The kids, there are subsidies if you have kids in elementary school, or even kindergarten. And I think there was a dental subsidy also. So if the kid was under 5, the dental care is free. It's picked up by the state.
It sounds like a great system. Do you see any abuse? Do you see any calls for reform? Is there something you look at it and you say this is wrong?
There's reform. There's a big call reform because it's unsustainable with the demographics. It's an aging society. The birth rate is nothing like Italy. And people tend to overuse the system.
Okay.
When you get a snuffle here, you're going to check your medicine cabinet and get Tylenol. Over there, people go to the clinic and get your medicine from the clinic. And it's a tendency to overuse the system.
There's a lot going on in the United States right now with Baucus and Kennedy and talking about tax in this. Lots of talk about health care. Is the Japanese system something we could import here, something we could duplicate? We both know, and everybody knows, there are huge cultural differences between Japan and the United States. Nimitz? No. Sorry.
I would say probably not. It's a system that's so controlled by the central authority, but Japanese are used to that, okay? Their education, the health care, even driver's license are the same, okay? From Okinawa to Hokkaido, it's the same. So there's no concept of state
or federalism,
which we have here. So people are used to this kind of system. I don't think Americans would be in for that, where the state controls so much of everything.
What about the overall state of health? I mean, it seems...
Well, that's another issue, too. It's a dietary thing. I mean, the Japanese eat a lot of tofu. They eat a lot of fish and vegetables.
Hippie food.
It's a really healthy diet. Tofu is a regular thing. It's not some kind of thing vegetarians would just eat. There is junk food, of course. But I think it's that you have people living till they're 80 or 90 years old and completely healthy. It's unsustainable. All right, the taxes are going to have to go up, or your premiums are going to have to go up. It's simply unsustainable unless they're going to raise taxes. Now, Last year they did throw money from the helicopter, or this year we didn't get that. And I think we picked up got close to like $1,500.
Stimulus money?
Stimulus money. And of course we know that they're going to turn around and tax us for this. So right now it's a 5%, I guess it's a VAT you call it in Europe.
Okay.
It's a 5% consumption tax. And we know that's going to be, they've already talked about raising that to 10%. It's just unsustainable. It's going to have to go up
All
to
right.
cause that kind of, but the level of care is terrific. You need emergency care, any kind of procedure, all modern equipment. The hospitals are terrific. But again, if you stay a week, think about it, okay? You're healthy, why stay a week? Somebody pays for that.
Yeah.
And all the testing as well, so it's just unsustainable. But the healthcare is great.
All right. Well, thank you very much, and tell everybody in Japan I said hello.
I will. Thank
All
you,
right.
Ruth.